Hi everyone, it's Dr. Daria here. I wanted to share with you today what I've found to be really helpful in working with patients with trickier presentations. Um, so, working with patients who have more issues with shoulder dysfunction or back pain or even hip pain that didn't do well with regular treatments usually have some underlying rotation in their spine that leads to a counter rotation through their rib cage. This is a central concept in PRI and one that I found to be super helpful. So, I'm going to tell you about what it is and why it might contribute to some of these difficult presentations. If you haven't already, make sure you follow me on Facebook, and I also have an Instagram. It's My Essential PT, so make sure you follow me there too for more tips and advice like this. So, we know anatomically that our rib cage is different right to left because our diaphragm is different right to left. We know that the right side has a higher dome of the diaphragm, and we have that nice liver underneath our right diaphragm supporting it. We also have three lung lobes on the right and only two on the left. So that makes space for the heart on the left, which is good. We want space for that. But it also makes that left side more expanded, which will close us down on the right even further. So this right side feels really dense and stable and supportive, and this left side is more expansive. It's like a big balloon pushing us over to this side of the smaller balloon. Also, the right diaphragm attaches lower onto the spine, which kind of pulls and rotates your spine a little to the right. So, just naturally, your spine and pelvis will be oriented to the right. But nobody actually walks around oriented to the right. So, what happens is your rib cage then counter rotates back to the left. So, those left ribs kind of come up and out, and those right ribs come down and in. So, the reason this is problematic is it's a three-dimensional issue. So, when the left ribs come up in the front, they get kind of flat in the back. So, what that does is it doesn't let your shoulder blades sit nicely onto your rib cage because your shoulder blades are kind of concave and they were designed to sit on an egg shaped structure. So, when that rib cage rotates to the left, that left side becomes flat and that right side becomes round. And now that left shoulder blade doesn't know what to do on that flat rib cage. Similarly, that right side is becoming rotated, so that right shoulder blade has a disadvantage because it's being kind of pushed out. So, this rotation of the rib cage can lead to either right or left sided shoulder problems. And a lot of times, traditional PT doesn't work well for some people because they're treating the distal problem, the shoulder, when the real problem is the rib cage. And obviously, for these people, many people have had surgeries that they don't need or injections that they don't need for the shoulder joint when really the shoulder joint is fine. It's the underlying rib cage that's causing the problem. So, the other area that people experience discomfort with this is back pain, like upper back pain, because or lower back pain, because that torque, that rotation of the rib cage coming up on the left and down on the right and creating that flatness in the back creates a rotation, especially around T8 where the diaphragm sits, because that's the point where the right diaphragm is more domed, the left diaphragm is more flat. So that's really that crux of that rotation. So a lot of times people get pain in their mid upper back, kind of like, right where the bottom of your shoulder blades is. That's a common spot. Or a lot of times people will get pain kind of right under the top of their shoulder blade, kind of pinpointed pain. That's a secondary rotation of your upper ribs. So this is what I call your extra level of specialness. So if your spine is rotated to the right, then we do this nice compensation of bringing our rib cage back around to the left in an unhealthy way. We shouldn't have to bring our rib cage back around because we should be able to have our spine in the center. What happens when you get that upper pain is your spine's rotated to the right, your rib cage is coming back around to the left, and then some of us will add an extra rotation in the top to bring that around to the right. And that causes the ribs to push up against the upper shoulder blades and be really uncomfortable. And that is something that if you're experiencing, you definitely want to come in and see a PRI physical therapist, because that's something that will need, hands-on help. That's not something that's easy to treat on your own. You definitely need somebody to help you with that. But some of these other things, you can do things on your own to help, which I'll get to. Um, One of the other things that you might not think are implicated with this rotation of your rib cage is hip pain or leg pain or even elbow pain. So if you're not using your shoulders well, then you're going to have to adjust for that lack of rotation through your shoulder blade and arm in one direction because of what's happening proximally. You have to adjust for that distally. So your elbows end up rotating more than they need to in one direction, um, which over time creates tendinopathies and tendon pain and just general elbow pain. So again, if you're somebody with elbow pain or shoulder pain and the regular PT or stuff that you're finding videos online aren't working for you, you may want to find a PRI physical therapist or look more deeply at what's happening at the deepest level of your rib cage and your diaphragm. The reason this can affect your hips is when you're walking, your trunk needs to rotate side to side. So if you're kind of stuck with your spine oriented to the right and your rib cage coming back around to the left, you're never really going to get good rotation of your trunk back to the right and good rotation of your spine back to the left. So when your trunk doesn't rotate well, you end up finding that rotation in another joint, specifically your hip joint, which has to make up for that lack of rotation up here. So there's a lot of reasons that I've described why you would want to improve and de-rotate your trunk in order to become more balanced and be able to go right, left, right, left. One of the best ways to do this is get air into your left upper back, called your left posterior mediastinum, which kind of translates to the space behind your heart space. So this zone, these left back ribs, tend to be flat because of everything we talked about. So to help that, you want to teach that spot to expand. One of the best ways to do this is to get these left ribs down, in, and back. It's very hard to get air into your upper back if your ribs are popped up in the front. So one very simple thing you can do is just take a towel, which I happen to have right here, and you put it over the back of your chair on the left side. And this is a pretty thin towel. It's not meant to push you forward. It's just meant to give you that sensory reminder and awareness. And then you're just going to sit all the way back in your chair so that towel is on your left lower ribs. And this chair isn't great, like it could be a little bit higher, but it doesn't matter. I still have that sense. I feel my left back ribs on the chair and I don't really feel my right back ribs. Just that alone is very powerful. So if you work at a desk, just doing that can be really, really helpful. If you want to make it a little better, you can add your breathing to that. So you would breathe in through your nose, blow out through your mouth, and let those left lower ribs move down and back. Then you're going to pause there, keeping that connection of your left back ribs as you breathe in. And just keep doing that. Just keep sensing that as you breathe in, trying to push into that towel. Doesn't look like I'm doing much, and it shouldn't because it's a breathing technique. Sometimes this is confusing for people because it looks like when I'm bringing my left ribs down and back that I'm actually turning to the left, but because this is a three-dimensional experience, I'm really taking that left expansion and anchoring that back down so I can come back to the right. So that's all I have on this topic. And as I mentioned before, make sure you follow on Facebook or on Instagram, My Essential PT. And leave a comment and let me know if you found this helpful or not, and if you have experienced any discomfort that you think might be coming from your trunk rotation. Thank you so much for tuning in, guys.